Hi, my name is Chelsea James, and this is my presentation over the Marburg virus. A little background for the biology portion of it. The Marburg virus has been researched to come from the Egyptian fruit bat, living in caves like Kitaki Cave and the Sinola Cave, where many tourists and miners would spend their time. A lot of the time, these miners would go and work in the mines without protection, so that's more than likely where they have gotten the virus from, is not being protected from these bats. So once the bat would encounter a cut or an open wound on the person, the virus would enter their system and then start attacking their immune system and much more than that, and I'll go into detail later. The history of the Marburg virus. In 1975, there was a case in Zimbabwe, but no one was really sure how the patient was exposed and where they were exposed. So a researcher, J.L. Conrad, tracked the patient and went back and traced their steps to see where they could have encountered the virus. And it went back to the person being involved in the Sinola Cave, which is what I explained in the biology part of it, is that's where the virus would come from, is the caves. And finding this research allowed better knowledge for the futures research, especially when a virus popped out in 2005 in Angola. Having these cases and having the information found and solved in these cases allowed for more quicker results and more ways of solving the future cases as well, especially for recent times like now. Some distinguishing characteristics of the Marburg virus is that it is a part of the Filoviridae family and is a filamentous molecule. The virus is typically around 1,000 nm long with a diameter of 80 nm. Some connection to human health. When the virus is within the humans, when they encounter this virus, the symptoms start off like flu-like symptoms for a couple days, like the first couple 3 days, with fevers, chills, headaches, and all of that. And then after about 6 days of those symptoms, the patients start to vomit, have confusion, have seizures, and then they start to vomit blood, which is hematemesis, and they start to have blood coming out of their anus, which is hematochezia. This is a diagram of the virus and the bat and how it encounters. Like I said, with the open wound right there, it comes through the wound and then it starts attacking the liver, the spleen, the lymph nodes, the kidneys, the blood vessels. Like I said, it's a very good diagram when describing in pictures, not just words, of how this virus can attack each of the organs and all of the systems that it attacks as well. Some more connection to the human health. When researching, I read an article that Adjemian had written about these 3 men that all worked in mines without protection. So these 3 men were involved with the virus and had encountered the virus. And one of these men that were studied, he showed up in the hospital with the flu-like symptoms, like said before. And then 3 days later, he began to vomit, to have confusion, and then the bleeding started. Once he had passed away, the autopsies of the patients had shown swelling of the heart, the spleen, the kidneys, and even the lymph nodes. Like I said, how the virus in that picture shows that that's what is attacked eventually as days goes on and as the virus progresses. So far, nothing has been confirmed about how many have survived, and nothing about how to cure this microbe and how to later figure out how to successfully handle and treat this virus. Some other important facts I have in the corner: there is a 20 to 90% fatality rate. It attacks the tissues and the blood vessels. It can cause swelling to the organs, and this normally occurs with no protection worn. Like I said, during the miners, when they were working and when they worked in the caves, there was normally no protection that was worn. So that involves the virus encountering their bodies and everything. That's kind of what creates this whole problem. Some comparisons between the Marburg and the Ebola, since most of the articles that I read were comparing both of these viruses because they're somewhat similar. Both of them are hemorrhagic viruses. I think that's how you pronounce it. This means that that this is like when the bleeding gets involved and how the virus progresses into the more severe situations and the more severe symptoms. That's kind of what that explains. They both are global health threats, which is it can get globally around the world if not taken care of seriously. Kind of like the situation we're in now. If people don't take it seriously and don't listen to the government and what everyone's saying, then it will progress and will get worse and won't ever, get solved. So they're both global health threats. Something that's different between them is the Marburg is less deadly than the Ebola virus. No one really knows why or how, but just research has shown and proven that it is less deadly. And with the Ebola virus, it is limited protection, meaning that it is very contagious and there's little that you can do to not get the virus. It's very contagious and there's not much that you can do to protect yourself from it if you're around it. Some interesting facts that I found when I was doing research that I just wanted to kind of share, that I found it interesting that a bat can cause so much damage to a human. You never really think that a bat can cause someone to bleed out of their mouth and start vomiting blood and everything. It's kind of interesting to think that, a creature that we don't really see that's kind of hidden in the caves can cause so much damage like that. I also found interesting that how quickly the symptoms progress over about a week or so. When I was doing the research about the 3 men in the mines and everything, how the man went in the hospital 3 days prior to having the flu-like symptoms, and then like 3 days later he showed signs of vomiting and the seizures and everything. I just find it interesting and quite scary how you can go from having flu-like symptoms to then vomiting and everything that he was experiencing. I also found it interesting how bats are not being more studied, or not as known, and not as known as a studied animal. Like, not a lot of people study about bats, and like you wouldn't think of having bats being studied very often, but considering that they're kind of a part of our zoos, and I don't know if they're a part of zoos like everywhere, but I know in Wichita we have zoos that have bats in them and have bats in the cave, and so I would think that they'd be more studied and more known about, considering that they could be around children. So I just found that interesting that they weren't more studied. And then another interesting fact is how similar this virus is compared to the coronavirus that we're dealing with now. I've researched about the coronavirus as well, obviously to just kind of protect myself and my family and friends. And I've read that it's flu-like symptoms as well. And then, a lot of deaths have occurred from this virus so drastically within these months. So I just found it similar and interesting that something that was a virus that was really occurring years ago is kind of popping back up in this coronavirus. And in the conclusion, I kind of summed everything up. The Marburg virus is a serious virus and nothing to overlook, just like the virus that is circling the world now, like corona. And by entering a cave with no protection on and having a cut or an injury or whatever to your arm, your hand, your finger, whatever, can expose you to this virus. And most of the people that are exposed don't survive, with the 90% fatality rate. As the days went on, this virus continued to attack the patient's immune systems, tissues, blood vessels, and many internal organs. Like I said earlier, it can cause swelling to the brain, everything, which is very, very serious. So that's something that you have to kind of look out for and make sure that you can kind of try to stay away from. And then the research that was collected narrowed the virus down to the Egyptian fruit bat, and hopefully more research can detect whether it comes from other bats or not too. And maybe future research can find ways to cure humans from this disease, or at least find a way to stop the severe symptoms and the severity of it, and kind of just bring it all together and hopefully come to an end to this virus. And here are my literature sites.